My name is Ernie Graham, and I'm the owner of 7 care homes that look after folk with high levels of dependency and nursing needs. And so my role is to try and support the managers and staff that do that, and also develop systems and system of compliance mainly that will be robust as we move forward. In a care environment, it's a mass of data really. So we got the data to do with the care delivery. We also have the data to do with the call bell data, for example, needs to be integrated. And we also need the data from the medication management system. And we have a full-on stock control barcoded system for medication administration, which obviously gives us a huge amount of medication data down to the second that each medication is dispensed. And obviously the challenge going forward will be combining that data with the care records, with the nurse call data, and also even with the staff time and attendance data, which we have an electronic system on. Ultimately, hopefully have the data all held in some central database or data warehouse maybe, where the combined data can be made sense of, and we can predict where areas of risks are in residents' care. But the real big dream that comes out of that is not just having a new way of recording what we do, but having a database that can be then really analysed well, and with the right algorithms eventually predict areas where there's risks, and that we can, by predicting where the risks are, amend the care plans accordingly and keep people even safer than now. For example, if people are at risk of falls or wandering away or having a UTI, so having those predictive capabilities is really important. So a challenge we have in the care sector is to be able to clearly communicate to the main stakeholders the essence of what we're providing, mainly the relatives of somebody who perhaps lacks capacity. There's simple ones, obviously, weight, amount of they walk every day, how much they eat, but then how the meds are going. But when you get so much data, the challenge would be getting the key parameters and presenting them in a user-friendly way. So there's a big opportunity to have some sort of even app that would be able to look at the data that's generated and actually translate it into a meaningful sort of stream of information that would reassure and inform really accurately and probably in real time to your relative what's going on with their loved one. So the sector that we work in, being for folk that are highly dependent and therefore really vulnerable, does need to be highly regulated as well. And the process of regulating what is a relational task often of providing care is one that involves a lot of judgments, but does need a lot of evidence to inform those judgments. And now that we've got outcome-based regulation, the key thing is with the data we're collecting from the care systems, whether they're care recording, care planning, medication, nurse call, whatever, is all very well, but when the inspector knocks on the door, we need to be always at the ready with indicators of what that data means, and translating hard quantitative data into qualitative measures of care outcomes. And so there's a plethora of systems that helps us to collect the data. We also have a portal and a dashboard that will present the data, but the bit in the middle needs to have a lot more development, and it is a challenge to be able to develop the analytical tools that will take hard data to represent soft outcomes. So the solution to trying to help us to evidence the outcomes that we provide more clearly would be to have software that would interrogate the hard data and using appropriate algorithms present that data in ways that link to the regulators' key lines of inquiry and provide that hard evidence in a way that us as providers can be really confident that we're fully compliant with all the regulations, but that also means that when the inspector calls, we're always ready to demonstrate those really clearly.